Magandang araw po sa inyong lahat. Alam niyo po, nagsisimula na po ang ating pagbabakuna laban sa Covid-19. At marami pa rin po ang mga katanungan tungkol sa pagpapabakuna, lalo na po sa mga buntis at yung mga buntis na may karamdamang gestational diabetes. Ano po ba talaga ang sagot dito? Pwede po ba tayo magpabakuna kung ikaw ay pregnant o kaya merong gestational diabetes? Ako po si Dr. Flora Mae Jacobo at nandito naman tayo for another edition of the Alliance of Clinical Endocrinologists InformationDrive. So we are here today to answer the most common questions of gestational diabetes patients regarding COVID-19 vaccination. Joining us as a resource person is the current treasurer of the Diabetes Philippines Incorporated, an accomplished diabetologist from Zamboanga City. Nandito po ngayon si Dr. Fatma Tiu to answer our question. So, sa unang katanungan natin, should I get the COVID-19 vaccine if I have gestational diabetes?
Hello, May. Hello po sa lahat ng mga nakikinig sa amin ngayon. So, yes, if you are pregnant and you are diabetic, or you are diabetic and you get pregnant, you should get the COVID-19 vaccine. Our Department of Health states that pag ikaw ay buntis, hindi naman ito contraindication to getting the COVID-19 vaccine. Though you can get the vaccine with precaution, given na medyo limited pa yung data natin about pregnant women receiving vaccines in clinical studies. So they say, if you are pregnant, you are diabetic, and you are part of the group that is recommended for vaccination. So kunyari ikaw ay frontliner, kunyari kasali ka ngayon dun sa grupo na binabakunahan, vaccination can be offered. It is advisable though that you get the vaccine after the first trimester of pregnancy. Yan po ang statement ng Department of Health natin.
Ito naman ang sunod na katanungan, Dr. Fat. Is it safe to get the vaccine?
Marami pa tayong hindi alam about the effects of COVID-19 vaccination on pregnant women. But there are things we already know. According to a newly published study in the American Journal of Obstetrics and Gynecology, COVID-19 vaccination are proving to be highly effective in pregnancy. So, epektibo siya. And another important information they saw is that yung mga women who are vaccinated are passing on the antibodies that they produce to their newborns. So, in early pregnancy, they also found yung sa, di ba yung tanong mo about giving it in early pregnancy, it has been shown that the virus is not actually associated with an increased chance of miscarriage. So recommendation yun ng DOH, but according to data, hindi naman siya associated with miscarriage. And vertical transmission wherein yung virus na ipapasa doon sa baby is relatively rare. And babies seldom get sick. So we also know that generally, yung mga buntis that who become diabetic are having only mild symptoms. However, they are also at increased risk for placental inflammation. Nagkaka-infection ang placenta and they can become very ill. So this in turn, pwede silang ma-ICU and then makunan. So just like the general population, pregnant women, especially if you are Asian, COVID vaccination is recommended because, then again, this vaccination can prevent the severity that can happen in a pregnant woman.
Maraming salamat, Dr. Pat. Napakalinaw po, na kagaya ng ibang kondisyon, mas mahalaga pa rin ang magpabakuna tayo kesa ang magkaroon ng infeksyon, di ba po, Dr. Pat? So yung susunod po na tanong is, yung bang bakuna po, makaka-apekto po ba ito sa sugar level po kung ay mayroong gestational diabetes o kaya buntis na mayroong diabetes? O nagpabakuna ba, ano kaya ang mangyayari sa blood sugar po?
Well, May, the vaccine itself will not affect the blood sugar directly. But because the vaccine can cause some symptoms, no, may mga naglalagnat, nagkakaroon ng mga body pains, this can lead to high blood sugar level. So, we should advise our patients, no, sabihan natin ang mga buntis na nagbabakuna, they should be monitoring their blood sugar for the next 48 hours. Although our gestational diabetic patients naman are advised to monitor their blood sugar with or without this vaccination.
Tama. Yun din po yung ating laging nire-remind o ina-advise sa ating mga pasyente, na kahit naman hindi po panahon ng pagbabakuna, dapat naman po talaga ay normal yung ating blood sugar. Sunod po nating katanungan, Dr. Pat, kung halimbawa po gestational diabetes siya na naka-insulin, is there a potential drug interaction between insulin and the vaccine?
So, at this time, there is actually no information available. Wala pang sinasabi na mayroong drug interaction itong COVID-19 vaccine and other medication. But it is not anticipated or wala rin naman silang nakikita that the vaccine itself would interact with insulin or other standard diabetes medications. But one thing that we can consider though is it may be helpful to avoid injecting insulin in your vaccine injection sites. So, kung saan ka binakunahan, huwag muna dun mag-inject ng insulin for several days after vaccination.
Okay. So, dapat planuhin mo na. Kung dito ka, dapat makaplano ka na kung saan ka susunod mag-inject. Okay, malinaw po yun. Kaya, again, mas mainam pa rin na magpabakuna. No? Lalo na kung ikaw ay high risk, di ba? Kung nagtatrabaho sa hospital at buntis ka, mas mainam talaga na magpabakuna muna dahil yung ating mga agam-agam na maaari itong maka-apekto sa ating sugar level ay alam na natin kung maaari ba ito at ano ang gagawin. No? So, kung halimbawa daw po ba ito hindi na buntis, pero siya ay nanganak na at nag-breastfeeding, pwede ba niyang i-continue yung breastfeeding after niyang mabakunahan?
Yes, May. Pwede kasi one important reason we vaccinate women is so they can in turn provide their antibodies to the baby. So, this is called passive immunity. Pag nabakunahan yung nanay, nagkakaroon siya ng antibodies and these antibodies that she produces are passed on to her baby via the placenta if she is pregnant or via the breast milk if she is breastfeeding. So, this will give the baby protection against the infectious disease. When the baby comes in contact or the baby is still maturing, no? Yung kanyang immune system hindi pa matured dahil nagkaroon siya ng antibody through passive transmission from the mother, nagkakaroon ng protection ang newborn.
Yun. So, yung ating kinakatakutan noon, no, yung karamihan, yung kinakatakutan nila na maaring makasama sa kanilang baby, lalo na kung sila ay lactating mothers or nag-breastfeed, ay mas dapat pa nga pala tayo magpasalamat dahil naipapasa through the milk yung mga antibodies ni mother. Kagaya lang din ito nung ating naging basihan kung bakit breast milk is best for babies. Diba, Dr. Pat? Ang isa pa po talaga na nagiging dahilan ng kanilang mga agam-agam or hesitancy ay yung pong mga side effects So, ano daw po ba ang mga side effects na maaari nilang ma-expect after receiving the vaccine?
Well, same side effects that you expect in the general population. But because, again, I mentioned a while ago that vaccine can cause symptoms of illness, no? Yung epekto ng vaccine like fever, body pains, for some, no? This is the one that can lead to the high glucose level. So, we just advise them monitoring. It is also important na hydrated sila, no? So, but so far, nakikita nila people with diabetes seem to be experiencing few side effects and minimal effect on their blood glucose levels.
Yun. So, ayan, napakalinaw ng ating mga naging sagot ni Dr. Pat sa ating mga katanungan. Ano? At excited na ba kayo magpabakuna? Ngayon na nalaman nyo na safe naman po ito at mas mag-benefit po tayo sa bakuna laban sa COVID. Diba, Dr. Pat? Ngayon po, okay, sige, magpapabakuna na ako at naliwanagan na ako sa aking mga katanungan. Pagka ba ako ay nabakunahan na, Dr. Pat, pwede na ba akong tumigil sa pagsusuot ng mask o kaya ay pagsusuot ng face shield pag ako ay mag-groceries? Kasi bakunado na po ako eh.
Well, you have to continuously wear your mask and your face shield and all your PPEs, no? Kahit nabakunahan na kayo. Why? 5 reasons. First, it takes time for the vaccine to protect you. Hindi naman pagkaturok, agad-agad, protektado ka na. In fact, the maximum effectiveness rate is about 2 weeks after your second dose if you are given the Sinovac or the Astra vaccine na meron tayo ngayon. And after the first dose, you have some protection, no? May partial immune response ka, which is good, but it does not work also immediately at hindi pa siya at its maximum protection. And you must remember, no? The vaccines do not provide 100% protection. So although they are incredibly effective, hindi naman 100%. Kahit yung sinasabi nilang mga measles vaccine, no, na binigay in 1963 pa, mga year 2000 pa na-eliminate talaga ang measles sa most parts of the world. So, pangatlo, ang hindi pa natin alam ngayon kung itong mga vaccinated people are not spreaders. No, they can in fact be asymptomatic spreaders. So right now, madami pa pong hindi nababakunahan sa ating bayan. So, we still need to protect yung mga hindi pa nababakunahan, yung mga immunocompromised, yung mga may sakit, yung mga matatanda, yung mga buntis na ayaw pang magbakuna or hindi pa nababakunahan. So, ang sabi sa vaccine, it can prevent illness, but more research is needed to determine para malaman if the vaccine also prevent transmission. So, right now, we don't know yet. So, we advise that people vaccinated should continue to wear masks until halos lahat na bakunahan na. And right now, they are still waiting for their turn to be vaccinated, and there are still limited doses of the vaccine available. So, we need to continue wearing our masks and our face shields.
Huwag po natin kakalimutan yung reminder ni Dr. Pat sa atin. Kahit po nabakunahan na tayo, tuloy pa rin po sa ngayon ang pagsusuot ng mask at ng ating face shield. No? Dahil nga po, ang bakuna ay para ma-reduce ang severity ng illness. No? At hindi niya ito pa kayang, sa ngayon, no? Hindi pa kayang ma-prevent yung transmission. No? So maraming salamat, Dr. Pat, at napakaganda. Maraming natutunan tayo ngayon. So muli po, Ako si Dr. Flora Mae Jacobo ng Alliance of Clinical Endocrinologists Philippines. To our pregnant diabetic patients and gestational diabetic patients, I hope that through this short presentation, we have learned that COVID-19 vaccine has the ability to protect you, your loved ones, and your community, and significantly reduce your chances of getting sick or experiencing severe complications of the virus. If you have more questions, it is best to seek your doctor's advice on the importance of getting the COVID-19 vaccine, especially for diabetic patients. Again, this is Flora Mae Jacobo for another edition of Alliance of Clinical Endocrinologists Philippines InfoDrive. Stay safe, everyone!